I am going to call to order this meeting. It's a regular meeting of the Hamilton County Board of County Commissioners, April 23rd, 2020. It is a virtual meeting, as we can all see. You can see who is on the call by way of the display on your screen. Thanks again to our IT guys for making this possible. As always, we will start the meeting with silent prayer and the Pledge of Allegiance. We, as you all know, have lost more people in Hamilton County to COVID-19. So once again, I will ask that we do a silent prayer in memoriam of those individuals, and then we will go into the Pledge of Allegiance. So just a moment of silence. Amen. Well, and Commissioner Dumas has the flag, so I pledge allegiance to the flag
of the United
States of America and to the republic for which it stands, one nation,
under God, indivisible,
with liberty and justice for all. Thank you. Thank you, Commissioner.
You're welcome.
All right, I'm going to move that we approve of the minutes of the previous session.
Second.
Commissioner Dreehouse?
Yes?
Commissioner Dreehouse?
Yes?
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you. I was just advised by the clerk that we don't have any public comments. So we do, though, have Greg Kesterman with us. Thank you again, Greg, for making the time. Greg's very busy nowadays and has been for quite some time now. So thanks for making time to be with us, Greg. Please bring us up to date by way of the numbers and some of the new things that we can check out on your website.
Fantastic. Thank you, Commissioner. Good afternoon, everyone. Today, I'd like to report the statewide numbers are currently 14,117 cases of COVID-19. There are also 2,882 hospitalizations, with 880 of those in the intensive care unit. In addition, there are 610 deaths. Here in Hamilton County, we are up to nearly 785 cases. We have 199 hospitalizations and 45 deaths as well. I shared yesterday that we do have a new dashboard for displaying some of our information by zip code. If you go to our website, hcph.org, you can see the cases as well as hospitalizations, deaths, and recoveries by zip code throughout Hamilton County. My team has spent a lot of time working to make sure that that data has as much completeness as possible. Obviously, each new day we get new cases, and when that happens, some of that data comes in and still needs some updating as far as demographic information. So I'd encourage everyone to take an opportunity to check that out. If you go to hcph.org and click on the COVID-19 link, you'll be able to see that displayed on the website. Commissioner, is there anything else you'd like me to provide an update on?
Yeah, could you talk about the information that you are gathering by way of demographics? As we have been told by you and others, and we had a briefing about this, there is a disproportionate impact, we think, on the African American community, both in Hamilton County and elsewhere. And so I know that you and your team have been working to get those numbers so we have a better way to evaluate what's happening in Hamilton County. Could you talk about that for a minute?
So it shifts by day, but generally speaking, my team is going back through the records and working within the hospital medical record to try and update information that is missing and hasn't come over. As of yesterday, many of those demographic pieces of data were able to get down to about 12% missing, which is a significant improvement. As I mentioned, that will shift. If we got in 30 new cases today, a good portion of those will need additional time and effort from my team. So we'll continue to devote effort to that and make sure that as we're bringing on more folks to do contact tracing, we're able to keep that data more complete so we can paint that picture. That website link, if you were to click on deaths at the bottom, it will show demographic data throughout the county on death, as well as hospitalizations and just generally cases. So it is providing a much more real snapshot of what's happening and a better picture for everyone.
Can you tell us, without us having to see that, what is the current data showing?
Give me one moment here so I can just read that off. I apologize.
Now, just to expand a little bit, so Greg, the health commissioner, has provided dashboards really about what's happening in the community, and as we go, they're becoming more detailed, more robust, and more inclusive of what we think we need to know. So I applaud public health for putting in the time to make sure that we have some way to analyze what's happening in Hamilton County.
So with regards to death data, we have, as I mentioned, 29 deaths in Hamilton County. 7 of those were non-Hispanic Black, 18 of those were non-Hispanic White, and then we have 4 unknowns. Similarly, with hospitalizations, we're seeing 27 of those deaths to be Hispanic, 94 of those deaths to be Black, non-Hispanic Black, 208 of those deaths to be non-Hispanic White. Other includes 17, and then we do still have, from today's numbers, about 103 that we're working to classify.
Okay. So we will continue to figure, these data points related to the population in Hamilton County and how this is all starting to play out. So we'll continue to kind of track all of that, just so folks know. Greg, is there something else, I'm trying to recall, something else fairly new on the website, another dashboard element?
We are showing recovered now. We've had a lot of questions about that. I've had also a lot of questions about nursing home data. Every week at 2 p.m. on the state of Ohio's website, they are now updating that. They did do a correction. Some of their data was a little bit inaccurate, and so they did pick April 15th as the point moving forward. They'll show all cases from April 15th moving forward. So some of the numbers that were reported in the press about a week and a half ago have now been adjusted on the state's website and do reflect differently.
Okay, great. Other,
Madam President.
yes, I was going to say, let's kick it around a little bit. Yes.
Okay, great. So, Greg, if my math is correct, it sounds like after that, the 25%, just, loosely, is what's affecting the African American community.
In our jurisdiction, which excludes the city of Cincinnati, Norwood, and Springdale.
Mm-hmm, mm-hmm. So 25%, is there a neighborhood where it's concentrated? Is there a neighborhood that's being affected larger than any other?
Not necessarily. On the map, there are a couple zip codes in the northern portion of the county that do have a slightly higher rate. We have not seen any trends necessarily with demographic data. Certainly, as you know, a large proportion of individuals that are elderly are impacted by COVID-19. We have seen the nursing home cases drive a couple of our zip codes a little bit higher. I would say at this point, that's probably one of the primary factors for one zip code being significantly higher than another.
Are the nursing homes?
That's correct.
I see.
As of yesterday, Commissioner, there were about 85 of our cases that were associated with nursing homes.
Oh, I see.
85 of how many, Greg?
85 of the 449 cases.
Yeah, significant portion.
Yeah, that is significant. Was happy to see that there is testing now in Barn Hill. Will that be expanded, and what does that entail?
So the testing in Bond Hill is being driven by Mercy Health. They have opened up the clinic, and they did so in order to drive up some numbers and to make testing more available. That has been shared with the other health systems, and so I know that they are hoping to continue to see an increase in opportunity for testing. One of the limitations that I shared yesterday during the press briefing held by Commissioner Driehaus was there still is a limiting factor for the state and CDC testing that is occurring. Those in the moderate to high risk are able to get that test, but those in low risk or having little symptoms to moderate without any risk factors are not as readily able to get that CDC testing. There is some private testing that is available through private labs, but it does still require a physician's note or a prescription to allow that testing to occur.
I see. Thank you so much.
Absolutely. Thank you, Commissioner.
Vice President Summer Dumas?
Yeah, I had a question. Greg, yesterday you had a visual up of 440 cases, and you broke it down as it relates to hospitalization, those that are recovered, and deaths. And I added those numbers up. It didn't quite equal 440. It was about 151 short, unaccounted for. And I was just wondering, is that number those who were tested and turned out that they were not positive? There's a gap. Mm-hmm.
No. So 449 is the total number of cases that actually had a confirmed test result, came from a lab, and were tested. Of those, a large portion of them are being encouraged, if their symptoms don't require it, to not come into the hospital, to stay at home and to get better at home. No differently than the flu, many of us who get the flu are able to recover safely and comfortably at home. But occasionally, those symptoms progress to the point that it requires hospitalization, and then in some instances, those individuals pass away. So the 449 is the total number, and you would have to include those that are at home recovering.
So when I added up those three numbers, I don't have it in front of me. I didn't know you would be there. It was like 289 when you look at hospitalization, positive cases, and deaths. So my question is, the 151, are those the ones you told to go home and take care of themselves?
That would be a correct assumption, yes.
Okay, thank you.
Thank you, Commissioner.
Mm-hmm.
One other thing, Greg, is that the positive cases, the hospitalizations, and the deaths are countywide, including the city, Norwood, and Springdale. But the recovered number is only under the jurisdiction of Hamilton County Public Health. So there's also a distinction to be drawn there.
That is a great point. And actually, the numbers Commissioner Stephanie Dumas was indicating, those were Hamilton County numbers. So the 449 cases are my jurisdiction, excluding the city. And the recovered also is excluding the city. Countywide, it's 785 total cases, or total positive cases, of which nearly 200 are hospitalized. My team is actually kind of looking at this dashboard that I've presented today in kind of a three-tier approach. We got the dashboard up so that we're a little more transparent with data. The next tier is trying to get as close to 100% on the demographic data. I realize it's a priority, and I want to also make sure that we're able to share that with the public as accurately as possible. The third tier to this approach, we are going to begin, after we get the demographic data squared away, working with the other three jurisdictions to try and fold them in so that we can have one spot for the entire county. Mm-hmm. We are a health district with other health districts inside, and I think it's important to show all of that data if possible for Hamilton County.
Yeah, it does get a little confusing.
It does.
All right. Any other questions for Greg?
I have no questions.
Yeah, thank you so much, Greg.
Yeah, thanks, Greg. Thank you for everything that you and your team are doing.
Mm-hmm.
Appreciate it. All right, let's move to comments and motions of the commissioners. Commissioner Summer-Dumas.
Thank you, Madam President. Just a few comments. Of course, as we all have been receiving a conglomerate of messages, emails from our constituents, which is great. And I'm sure we're all trying to resolve them the best way that we can, or either refer them to other departments. In addition, I continue to look at the budget and try to make budget recommendations. I think Finance Department and all the other departments are doing a great job trying to downsize and to meet that 20% threshold. And also I've been involved, as all of you have, in several webinars. Auditor Faber had one. And to mention that the Family and Children's First Council, which I am a member of, is undergoing a audit right now, which should be completed in September. I also was a part of a webinar with Senator Brown regarding the CARES Act, and my chief of staff was involved with the impact of the African American community with the COVID virus. And also NACO continues to have their briefings. I also had an interview with Lincoln Ware last Friday on his station. It was very good. Got some people called in with some questions, and I hope to do that on a more regular basis. Let's see. I'd like to mention about, give my condolences to the family of Mayor Susan Farley, who passed. I just got notification just this morning. She's been a long time mayor of Woodlawn. She and I were together back in 2013 when we both received the Nefertiti Award, and you do not want to sit next to her because she is just the funniest person. The Cincinnati Herald gave her that award also. And just recently, this January, during Black History Month, we gave her a proclamation and a rose for her during that time. So she will be surely missed, and I want to give my condolences to the family. And that will end my report, Madam President.
Thank you. Commissioner Parks.
Yes, thank you, Madam President. I am so sorry to hear about the loss of Mayor Farley. She's been such a great leader and example to what can be done in our community, and she will be sorely missed. So I, too, extend condolences. Also, I'm reminding the public to kindly participate in our office's hashtag, Denise, hashtag 513 Survive initiative that was introed last week that gives voice to young people of color's experience during this COVID-19 pandemic. As I said last week, our only job as leaders and elected officials is to preserve the world we live in and to utilize our platforms to create a better world for the future. That's our youth. Like Greg was talking about the statistics of how COVID-19 affects the African American community at the disproportionate rates because of higher rates of underlying health conditions and less access to care. So I'm happy to hear about the testing site in Barnhill provided by Mercy Health. Second, Black Americans hold a lot of essential jobs. Thirdly, there's insufficient information and housing disparity. All of these factors affect young people, and we need to know what they're going through because we need them to survive. So again, I'm reminding young people to participate in this initiative, 513 Survive. Let us know what you're going through. If you draw, paint, dance, write poetry, sing, rap, or just want to talk. However you express yourself, you are invited to use your cell phone and take a video and send it to us at this email address.
Say it, Victoria.
It's 513-survive@hamilton-co.org. That's it. Thank you so much.
Very nice. Yeah, it's a great initiative. Thanks for doing all of that.
And yeah, we're so excited. We have some of the neatest videos ever.
Oh, good. So when will you be ready to share?
Well, we're going to see how many we get in order to put it together, but it won't be long. So next week is the deadline, next Friday,
Okay.
May 1st.
Great. Great.
Commissioner Parks, I noticed the paper you held up did not have the hashtag in front of it. Now, does
Right.
that...
Right, because this is the email address.
Okay, I didn't know if you went...
Okay, now, I'm not so good with Twitter, but my chief of staff is. Yeah, so, hey, Denise, hashtag. So,
You see it?
so you can Twitter or tweet, whatever it is. You can tweet 513, hashtag 513 Survive.
Okay.
Tweet like that, but the initiative is called hashtag. We would have had the hashtag, but we can't put that in an email address.
Okay, thank you.
My pleasure.
Mm-hmm.
Victoria, look. Can you see it?
Oh, yeah, mask up. Hashtag.
I'm channeling you and Renee Mahaby here.
Jamming.
My son, by the way, loves it when I do this. He's like, Mom, stop doing that with your fingers. I'm like, no, it's a hashtag. Oh, he's like, no, stop. So thank you both. I have just a couple things. One is I want to acknowledge that we continue to make budget adjustments as we go through the COVID-19 impacts here in Hamilton County. They've been rolling out for about a week. At this point, we've got about 240 furloughed employees. Some of those are people that work for us and other offices, of course. I do want to say that we're using restricted funds. We're looking at dipping into the reserve. We're redeploying employees. We've cut back, obviously, on capital expenditures for buildings, all of the things that we had hoped to do with that extra quarter cent are now on hold. All the economic development money is on hold. It's just, it's a really challenging time, but our employees are, stepping up and bearing the brunt of a lot of this. So I do want to say that it's a tough time, and we're grateful for them helping us meet some of these budget targets. I also want to thank Jeff Aludo and the budget staff for doing the hard work here to try to get us to a point where we can respond to what we know are going to be significant reductions in revenue. So that said, one other thing, and Greg covered, a lot of the COVID-related information. There was an alert that went out in Hamilton County today related to overdose deaths, related to addiction in our community. I don't want to lose track of this. While we have seen numbers decline when it comes to transport to the ED and some of the 911 calls, that does not indicate what we're seeing by way of deaths. And we think what's happening is that people aren't calling 911 or don't want to go to a hospital right now because of COVID-19. And so some of these other situations are flying under the radar. And so we have had 13 deaths related to overdose in the last 5 days. Wow. That's a lot. Mm-hmm. And so we issued an alert this morning. The alerts go out to make sure that our first responders know that this is a dire situation. They must have enough Narcan on hand to revive somebody. Sometimes it takes more than one dose of Narcan, given the amount of fentanyl and carfentanil that's out there right now. It also makes people aware that they should be carrying Narcan. If they know someone that suffers addiction, carry the Narcan. You don't know when you're going to need to use it. So I just want to highlight that, because as much as we've been talking about COVID-19, and rightfully so, I don't want to lose track of the fact that people that suffer, especially addiction issues and mental health issues in this community, are really struggling right now. And so we're in a tough situation, and it's going to continue to be difficult for people as we live in isolation. So I just wanted to make sure my colleagues were aware of that alert that went out this morning. Jeff, what do you have for the good of the cause?
Thank you, Commissioner. Just a couple of things. Number one, I want to echo what you had indicated and thank all the employees of the county for everything they're doing to help us pull through these times. Both those employees that are working operationally on the front lines right now, as well as those employees who have been asked to do things like take furloughs and pay reductions. Again, we hope, and we all hope, that these times are temporary, that we get through them. But I know that there are people that are experiencing pain right now in that regard, and I just want to acknowledge that and thank everyone for their efforts, and to thank the department heads and elected officials as well, who have difficult decisions to make in these times. And I can say, having spoken to just about every department head or elected official who is in the county at this point, that everyone is taking this seriously. There's not a department I've spoken to that is not taking this seriously. We will shortly be releasing projections, and we'll be doing budget re-legislation probably as early as next week. And even in the context of looking at some of those and seeing that some departments are taking less reductions than others, number one, there's some departments that are still working on plans, and where that is the case, there's typically very good reasons for why departments are still working on plans. But even though the amount of reductions are going to differ and they're never going to be completely coordinated, I can say without hesitation, everyone is taking this seriously and coming to the table with what they can do. So I just wanted to thank folks for that. Also, I wanted to just give a brief update on the CARES Act. We did receive some additional guidance from the Treasury Department, sent that out to the board this morning. The guidance told us some of the things that we knew we were going to hear. Number one, that at this point in time, the CARES Act revenue cannot be used for revenue replacement. So that's unfortunate, but we also knew that was coming. As of a couple of days ago, we were hoping we were going to get some relief there. Commissioner Driehaus, as you indicated, but we learned in the rules today that not only did we not get that relief legislatively, but the Treasury rules do not allow for it. There is some good news, though, in that some of the allowable uses that we see, I think, are going to allow us in certain places to use the funding flexibly enough to help us in some general fund and budget areas, although not as significantly as if we could use it for general budget stabilization. But we're going to do what we can do to marry the need of the response with the need of our budget, where those two intersect, but of course deferring to the overarching philosophy that it has to fit within the allowable uses of the CARES Act for sure. There was some additional information in the guidance that I thought at first spoke to one of our overriding questions, which was the county's ability to provide subgrants to its communities. It didn't exactly say that. It said that the state is able to grant some of its dollars to communities under 500,000. It did not speak specifically to the issue of a direct allocation community's ability to do that. So we're going to keep asking that question. But slowly but surely, we're starting to get answers to some of our questions here. And in the meantime, I think, as you know, the administration is working on putting together that broader plan for the board's review based upon your policy guidance at our last meeting. And I would anticipate having something for you sometime next week on that. So more to come, but that concludes my comments.
Thanks, Jeff, and thanks again for all your work. I do want to say that over the weekend, we did have a bit of a lobbying effort trying to get some flexibility with these dollars to our federal delegation, specifically Congressman Wenstrup, Congressman Shabbat, Senators Brown and Portman, all of whom were open to the idea of having some flexibility with the dollars that are already coming so that we can use them. The last thing we want is to leave dollars on the table because we couldn't apply them to some of the needs in the county. So I do want to give a special shout out to Rob Portman and Sherrod Brown, who have put out statements they both said that they're open and supportive of this kind of flexibility that we've been advocating for. So they have been champions in Congress for us. So thank you to them, and thank you to others locally who helped, sound the call. Bill Seitz is Representative Seitz was very helpful. Rod Gehring was helpful. So anyways, just it's kind of been a bit of a team effort, a bipartisan effort, and so we'll continue to try to get the flexibility we need. So thanks, Jeff, for all your work on that. So we have a number of regular agenda items. I believe the engineers got 1 through. Oh,
Madam
sorry.
President.
Yes.
I'd like to ask Jeff a question.
Sure.
Jeff, is there also an additional round of financial deliberations that may include some general funding for us, even though we didn't get it this time? My understanding that it may come up again in the next deliberation.
Yeah, so we were asking for it's a good question. We were asking for 2 things in this latest round. One was additional flexibility on the CARES Act dollars that we already had received, plus we were asking for another round of funding. And that was really an effort by NACO and the U.S. Conference of Mayors and others to coalesce around many of these communities under 500,000 who did not receive direct allocations, but the county, of course, would have benefited from that as well. So in this latest round, we got neither. We didn't get the flexibility, nor did we get this additional round of funding. We were hopeful for both in the next round, and I think we've heard helpful things and hopeful things from members of our congressional delegation. I think even the White House has said some helpful and hopeful things as it relates to that. But I think I'm maybe more hopeful on the issue of flexibility. I think as more and more stimulus rounds happen, I think it's going to become harder and harder and harder to get more money directly. So I think we are hopeful for both, but at this point in time, hoping at the very least for flexibility in our current CARES Act spend.
Okay, thank you, Jeff. Thanks for all you're doing, too.
You're welcome. Thank you.
Madam President, Jeff, I have a question for you. What could possibly happen in where it says that the state can allocate to jurisdictions that have less than 500,000 people? What kind of possibility does that present?
So the state of Ohio was allocated, I think the number was around 4.5 billion of the total CARES Act allocation, and that was based upon the state population. And of that, that amount was then split out through a formula to the various direct allocation communities in Ohio, which include, just all the communities over 500,000, includes several counties, also includes the city of Columbus. So there has always been this thought that a portion of the dollars that the state would receive would then be shared with other, with the other communities in Ohio under 500,000. At the same time, we're also hearing that there's some guidance from the state coming that no, if you live in a community that has already received a grant, you need to go through that community. So we're still learning the way this is going to work, and I don't have all the answers for you at this point in time, only to say that I can say that initially there was some thought that the state would be allocating dollars out to some of the smaller jurisdictions. But I don't know whether that has changed in any of the rules that came out from the CARES Act over the past month or not, and whether that was expressly prohibited. But it does now appear, at least in the Treasury guidance, that the state is allowed to make those authorizations and subgrant those dollars to other levels of government. We'll just have to see how it plays out here in Ohio.
Okay, thank you.
You're welcome.
Jeff, did you just say that if a community, say, Chivy at Deer Park, Gulf Manor, Forest Park, if they reside in Hamilton County, which was eligible for the CARES dollars, they might not be eligible for any kind of allocation from the state?
I can't confirm that. I can just tell you anecdotally, I've had some conversations with communities that have told me that they have been told by different folks that they've contacted that, oh, you need to go through the county because the county got an allocation. I don't know whether that is coming from any specific place or whether they're just hearing that anecdotally themselves. So we're still looking into it, and as soon as I know more affirmatively, I'll let you know.
So I guess it'll be important then to draw some parallels between the flexibility in the dollars that would come from the state versus the lack of flexibility that we have right now with the CARES dollars. So that'll be important to track. Yeah, okay. All right, thank you. Anything else for Jeff?
I don't have anything.
Okay, thank you.
No, thank you.
Thank you. All right, back to the county engineer. Am I right, it's items 1 through 5, or 1 through 4?
1 through 4, that's correct.
There we go. Eric Beck is on the line.
Yes, thank you. Hope everybody is doing well. Items 1 and 2 are both authorizations to let contracts. Item 1 is the 2020 resurfacing program, and that is our engineer's estimate is $2.9 million. That is a reduction from where we originally planned to go at $4 million. So we've cut back there based on any potential lack in revenue we may have. That includes resurfacing on Harrison Avenue, Struble Road, and Patty's Run. And then item 2 is a guardrail replacement or substandard guardrail on some of our roads. In particular, Blue Rock, East Miami, Van Blorkum, and 5 Mile. Item number 3 is an appointment for myself onto the Ohio Public Works Commission Integrating Committee, and Todd Long as my alternate. And then item 4 is the award of a bid for the Westman Road landslide corrections. It was bid in February. That has FEMA funding. That's for 2 landslides on Russellman Road. I'd be glad to answer any questions if you have any.
Please remind us of the funding source here for the 2.8.
That's out of the Road and Bridge funds.
Okay, just want to note that this is not the general fund allocation.
That is
None of them
correct.
are, obviously.
Correct.
Just want to make sure we're clear on that.
Yes.
Any questions or comments?
No questions, but Madam President, I think it's great that you asked the question to Eric, and that we need to continue to let people know that are listening that it's not out of the general fund. So that's all. Mhm.
Yeah, Commissioner Parks is good. All right. All right, thank you. I'm going to move that we approve of regular agenda items 1 through 4.
Second.
Commissioner Dreehouse?
Yes?
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you. Thanks, Eric. All right, our next item, item number 5, is related to MSD. I can see that Jack Rennekamp is with us. I think Diana Christie is with us too, so I will leave it to you as to who speaks to this item.
Good afternoon, Commissioners. Jack Rennekamp.
Jack.
So we have one item for your consideration and request approval. It's a local sewer assessment project, Markley Road local sewer for house numbers 931 through 977. The request is to appropriate $260,000 for construction of the project. And this is, as I said, a local sewer assessment project. So this project would eliminate and benefit 6 property owners on Markley Road. These are the only ones remaining in the immediate vicinity for a public sewer, to be connected to a public sewer. The project was supported by all 6 of the benefited property owners. They all agreed through a petition as well as a waiver process that they wanted the sewer. They're willing to pay the cost of the sewer, which is $12,000 or up to $12,000 per MSD rules and regulations, as well as they are willing to not object, and there is no need for a public hearing. So that's why this item is before you today, without having the precedent of it, as we do normally with local sewers for public hearings. The estimated project cost per parcel is $80,000. Based upon MSD rules and regulations, 5 benefited property owners will pay up to $12,000 for their share of the project costs, and 1 property owner will pay up to $8,400, being credited $3,600 for an existing HSTS or home sewage treatment system that he gets a credit for under the MSD rules and regulations. The project, if you approve it today, is planned to begin construction in November of 2020 and to be concluded by April of 2021. If you have any questions, not only is Director Christie with us today, but also the project manager, Aaron Burkhart, is available as well.
Thank you. Yeah, so this is in Anderson Township?
This is in Sims, I believe.
Oh, Sims Township. Okay.
Aaron, correct?
This is in Anderson Township, yes.
Oh, Jack.
All right.
That never happens.
You loved it.
Okay, well, this sounds to me like a slam dunk, but, so thank you for your work on this. Does county administration have any additional information? Okay, so Karen Ball just said they support the project. Thank you, Karen. Commissioners, any comments or questions?
No comments, no questions.
No comment.
Okay, very good. Thank you from MSD. Glad to be moving forward on this one. I'm going to move that we approve of regular agenda item number 5.
Second.
Commissioner Dreehouse?
Yes?
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you. Thank you all from MSD. All right, we're going to move to the consent agenda items. For the information of the board, number 7 has been pulled. Pulled due to the COVID-19 situation that we find ourselves in. So that's really being pulled and put on hold, I think. So we've got consent agenda items 6 through 9. Are there any questions or comments related to these items?
No questions, no comments.
No questions, thank you.
Thank you. All right, then I'm going to move that we approve of items, consent agenda items number 6, 8, and 9.
Second.
Commissioner Dreehouse?
Yes?
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you. Before we go into executive session, is there anything else, Jeff, or either Commissioner Summer Dumas or Parks that we need to talk about?
I have nothing, Madam President.
No, nothing. Thank you.
We just don't see each other that often, you know. Need to put it out there. Jeff, anything else?
Nothing further, Commissioner.
Okay, all right, then I am going to move, and here's how we're going to do this, by the way. We've never done a virtual executive session, and so we have two. We are going to move into executive session and do it by way of a conference call. So we're going to conclude this Zoom meeting, go into a conference call. We are not taking any votes after the executive session. And so we will simply adjourn by conference call as we typically would if we were sitting in a conference room. So Bridget, do we have, I assume we have that conference call information? Okay, very good. So in that case, I am going to move that we go into executive session pursuant to RC section 121.22G3 to conduct a conference with an attorney for the public body concerning MSD, and an exec session pursuant to RC section 121.22G2 to consider the purchase of property for public purposes, the sale of property or at competitive bidding, or the sale or other disposition of unneeded, obsolete, or unfit for use property.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you.
Hi.
Are you ready?
Hi, hold on one second. We just got to get this live. Ready.
We're going back one.
You're going to leave executive session by motion and adjourn the meeting. All right, so I'm going to move that we close executive session and adjourn. Second. Commissioner Dreehouse? Yes. Commissioner Summer Dumas? Yes. Commissioner Parks?
Yes.
Very good. Thank you.